had great experiences. I mean, I've gone in, when I went in, tore the ligaments in my ankle, boom, I was looked at right away.
I have a friend from Seattle, and he was down here, and he tore his ACL, but he couldn't see a doctor in Seattle because he didn't have insurance. So at least here we have the possibility of seeing someone in 3 months, you know what I mean?
Yeah.
At least we get to see someone, even if we have to wait.
Yeah.
That's a really interesting misconception a lot of Americans have, is that somehow you're lining up forever and you can't get a doctor, and it's like a card, you sort of, at a bakery, you sort of get served by whoever comes next, but it's not that case at all.
Waits are pretty common. I have been waiting to have lithotripsy done, which is the bashing of the kidney stones. I have been waiting since December. It's a painful thing, and to be waiting that long in pain to me is ridiculous and very inhumane.
I haven't experienced any problems because I don't get sick, because I live a very healthy lifestyle. So, knock on wood. Long waiting times, I would say, for simple surgeries, like hip replacement, things like that, waiting months and months and months while things deteriorate and get worse. That's what I've heard. My hips are fine, so...
Things happen quickly.
Things happen quickly.
Very quickly.
In spite of the fact that people say, you know, there's overcrowding, it's still good, could be better.
On our Seacouver study tours, we found a range of opinions, beliefs, and myths about our healthcare system and about the Canadian healthcare system by both Americans and Canadians. We also participated in didactic sessions at the University of Washington in Seattle and the University of British Columbia in Vancouver to learn facts about both systems from experienced physician leaders and policymakers. It was our aim to create this video in order to share the opinions and thoughts of Americans and Canadians. As values and perceptions are often as important as research and studies in informing policies, we hope this video helps to spark more discussion among medical students and among Americans in general about values and healthcare access. Future physicians have a duty to do our part in making sure the very patients we have been trained to treat have access to care. We hope to be the generation of physicians and of Americans that comes together to creatively improve healthcare access and quality of care for all Americans.
What would you say to the people who are trying to fight for universal access to healthcare in America?
Don't give up. Keep fighting for it. I think it's a great system to have.
I'd say keep going, fight for it, keep at it. Because if you don't fight for it, they're going to take it all away from you.
I think other models that you should look to are Denmark, Sweden, Switzerland, Britain.
You know, I'd say both in the United States and Canada, everybody needs to fight for their rights.
And I want all you Mexicans, all you doctor Mexicans, to get out there and give them that good health care. Absolutely. They deserve it. We all do.